Health Minister Ong Ye Kung says an Omicron wave is imminent as it now accounts for 17% of local COVID-19 cases.
Well, for more on this, we're joined by Professor Dale Fisher, Professor of Medicine at the Yong School of Medicine. He is also the Chair, Global Outbreak Alert and Response Network at the World Health Organization. Dr. Fisher, the last time we spoke, the Delta virus was on the rise and running rampant, and your advice then was to stay the course to an endemic Singapore. Is that still your advice now that Omicron cases are creeping up? Are Singapore's measures robust enough, or has the transmissibility of Omicron changed the game?
Thanks, Jill. No, the plan is still to stay the course. That's the strategy. Singapore has always had the strategy of a sort of a cautious stepwise opening rather than Freedom Day. Omicron has, I think, caused a pause in the easing of restrictions. But ultimately, what matters still, whichever the variant or the future variant is how many people are getting severe disease. It's severe disease that obviously affects people. It affects the hospital's capacity to do its job. And actually with Omicron, we are seeing some hospitals overseas seeing big spikes in their cases, arguably overwhelmed. Because even if this is less transmissible, which is certainly the way it seems, and milder the way it seems, still, if you get a lot more cases, then even if there's not so many severe cases percentage-wise, it can still be a large number that can impact hospitals. Now, as we know, yesterday there were 18 COVID cases in ICU. So we've actually haven't been better placed for some months to deal with a surge. But as I said, I don't really expect a surge of severe disease. I expect definitely a surge in cases as Omicron enters Singapore.
Professor Fisher, you talk about Omicron entering Singapore. When this Omicron was first confirmed and announced, different countries at that point were actually opening up, lifting their borders. They then shut their borders, and restrictions generally have been tightened globally. Do you think Singapore needs to be relooking, retweaking its VTL policies at this point?
Well, actually, Singapore, by international standards, has still got very, very tight restrictions with quarantine coming in and all the testing. So I don't think we really need to look at it, because actually we haven't undone it. It's been part of the strategy, is we've never known what's around the corner. So we just want to be cautious. We know we can't keep Omicron out, but even when we had Delta with very strict controls, it was still making its way into the country. But we're only 8 weeks into this since it was first identified in South Africa. This is Omicron now. So if there's no more surprises and Omicron does seem as mild as we believe it is, then I think further easing could be around the corner. But we need to make sure Omicron's not going to have the impact, the worst scenario impact on the hospital system. We need to know what it's going to do in the Singaporean context. So I think we need to buy a little bit more time.
That is a great point that you've raised, because we've seen it, how it's unfolding in other countries. What have you observed in that fairly short time that we've had of local Omicron cases so far?
Well, we actually haven't had a lot. We haven't had a natural experience with Omicron, if you like. The vast majority of cases are still imported. Obviously, because there's surges going on overseas. So these diagnoses are being made in people on stay-at-home notices and therefore isolated when they're diagnosed. So we've had a couple of clusters that have been reported, but it hasn't been allowed to take off. So we're still relying heavily on the overseas data, which is that it's more transmissible, seems to have less hospitalizations for the number of people infected. And that might be because it seems to have a greater affinity for the upper airway rather than the lungs, which causes pneumonia. The other big difference here is that our vaccination rates are still much better than overseas. So this will also need to be factored in with our own local data, which will come over the next weeks for sure.
Apart from this study you mentioned, I think it was out 29th December, on whether it affects the upper airways or the lungs, we also, initial studies suggest that Omicron interacts differently or has different effects on us based on what sort of vaccines we've had, whether it's the mRNA vaccines or Sinovac or Covaxin, and as well as the effects that booster jabs will have on controlling the spread of Omicron. At this point, and I realize it's asking you to perhaps make a less absolute statement, but what do we know so far about Omicron vaccinations and booster jabs?
Well, what we know is that it's still very effective in preventing severe disease, and that's what we have to remember as our strategy. We can tolerate people getting common colds, for instance, and we're going to see those. But as long as vaccinated people aren't getting severe disease, then that's when we can remain confident and start sort of easing restrictions again. We know that none of the vaccines are none of the current vaccines, at least, are preventing mild disease. It works very briefly, but after months, we know that it's mild disease still spreads. So the focus has to be on severe disease, and the vaccines are still working there.
Oh, thanks so much for that, Professor Fisher, sharing those insights with us. Professor Dale Fisher, he's Professor of Medicine at the Yong School of Medicine, and also Chair, Global Outbreak Alert and Response Network at the World Health Organization.